I would like to introduce to you Pamela Sheran, Vice President, Strategic Programs and Partnership from Smile Train. Thank you so much, Pamela, to be with us today. It's such a pleasure. Thank you.
Thank you so much, Isabel. It's such a pleasure to be here with you all. I wish I was there in person, and I hope that next time we all come together to share the incredible story of art and the power of art, that I can be physically with you all. But thank you for this opportunity to connect virtually. The team has been incredible. So as mentioned, my name is Pamela Sheeran, and I represent Smile Train, a global children's organization focused on empowering local medical professionals to provide surgery and comprehensive cleft care for people born with cleft around the world. We're extremely proud to be here to share our experience of working with Isabel Waxmuth and the Art Impact for Her Health initiative, to stand here on the stage next to these incredible organizations. I mean, just listening to the story from South Bank was incredible, and I can't wait to hear from the others. We're all here to try and inspire everyone around the world to leverage the incredible power of art to build resilience and healthy communities for the most vulnerable and those most in need worldwide. So a bit more about cleft lip and palate, which is Smile Train's main focus. Cleft lip and palate is, and this is the next slide, please. Thank you for the group helping. Thank you. Cleft lip and palate is one of the most common birth differences worldwide, affecting 1 out of every 700 healthy babies on average. Children with cleft face many health challenges, first and foremost being their difficulty feeding, thriving, and even surviving in many regions. With or without cleft surgery, cleft-related challenges can continue as children develop, including those related to oral health, speech, and psychosocial development. These challenges are often compounded by the children's marginalization and lack of access to care, which in turn causes stigma, out-of-pocket expenses, and geographic barriers to access. This next slide, please. This has a tremendous effect on the children's families, in addition to the larger community and society, and of course the children themselves. And there are so many families in need of comprehensive cleft care today. You can see in these images that I'm sharing how the souls of individuals, of families, of communities can appear weakened truly because of the lack of access to care. Next slide, please. Smile Train, the organization I represent, is dedicated to advancing progress towards SDG 3, just in response to what Gareth was challenging us about, thinking about the Sustainable Development Goals. So our dedication to SDG 3 on good health and well-being, as well as health for all, by reducing barriers to care for individuals and families impacted by cleft lip and palate. We know that achieving SDG 3 and achieving health for all means reducing barriers for all, even people beyond cleft. It means whether you focus on clefts or social change or mental health, you're working with a collective system. Smile Train works to not only support cleft care, but transform systems of care through partnerships with local medical professionals, offering essential training and resources so they can provide comprehensive cleft care for children with clefts in their own communities. This ensures that local medical professionals can stay local, have the resources they need to be local heroes, and build stronger healthcare systems overall. Next slide, please. Smile Train recognizes and honors the power of art. For individuals with cleft and for their communities that Smile Train supports, art is an important part of psychosocial health. It helps children, families, and even medical professionals share their fears, express their hopes, explore their identities, and build resilience. Through the Art Impact for Health initiative with Isabel, and now through the immersive exhibit that you're all here with today and the new digital platform, we see clearly how art can build resilience on a global level and how it can unite so many people to achieve a common purpose, to build a resilient global community with a collective to make health for all a reality. As my closing with you all today, I would like to share a brief video, less than a minute, from an important Smile Train partner, medical professional, and artist, Dr. Antonio Zagara. He was with you all when last time you gathered in the same space in October 2020. He explains in this video what happened during Smile Train's Art Impact for Health event that happened in Lima, Peru in March 2020. He is showing a sample of the masks that actually you'll see here at the event. These masks were made by a variety of Peruvian artists to help inspire or motivate the children born with cleft during the Art Impact for Health event. I encourage you to visit the Smile Train section of the exhibit so you can learn more about the specific experience with Lima, and also another one in Colombia, and be inspired to leverage art as a way to build resilience and bring health to all populations in need worldwide. Thank you so much for listening to the following video, also for my short speech, and tremendous thanks to Isabel for her leadership, shared joy, and wisdom. So thank you. Please go to the video.
The result was incredible because the child concentrates and connect with something higher and for me it's similar to the meditation. And they manage to forget for a moment the hard path of their life. In addition, parents know and talk about their experience, and they are not the only ones who have these problems. My conclusion is that the art should be part of the doctor prescription, not only for a child with CLIF, for any disease.
Thank you so much, Pamela, and as well, Antonio. It's so touching. And now